Hi, I'm Dr.Diviya, your gynecologist. Now Miss Second is celebrated as the Fertility Day. I am making this video in honor of that, and today I will be talking to you on what is infertility and what are the treatment options that are commonly available with us. Firstly, you need to understand is what exactly is infertility. Medically, it is defined as the inability of a couple to conceive after 1 year of having unprotected intercourse. So the definition clearly states few things. Number one, fertility per se is a couple problem. It involves both the husband and the wife. So it is very unfair, incorrect, and unrealistic to be testing, evaluating, and treating only the women all through. Unfortunately, that is the circumstance nationwide. If your fertility is your concern, please go in for consultation as a couple. Both the husband and the wife has to be present on the consultation day. At least on the very first day that you are planning to meet your doctor, make sure that you're going in as a couple. Why am I insisting on this is because we would like to have an elaborate chat with both of you to acquire few very important information that will be helping us to frame your investigation and treatment. By doing so, you will be having a benefit of having a better treatment, and you will definitely be saving time on doing so. The second thing that you need to understand from the definition is that it states that the couple needs to have 1 year of unprotected intercourse, which means that they should not be using any kind of contraception, not even condom, not even the withdrawal technique. So no method of contraception should be used for 1 full year. So do not go in for a fertility assessment or a treatment within like 2 months or 6 months or 8 months after your wedding, because your sister-in-law or a friend conceived very soon after the wedding. Take your time, take a full 1 year of planning prior to meeting your doctor. The only exception for this rule is that if the woman is more than 35 years, you can meet your doctor after 6 months of having unprotected intercourse and having inability to conceive. You can definitely meet your doctor after 6 months, and do not keep waiting for the completion of this full 1 year if you are 35 or 35 plus. So what are the treatment options? What do we have to give you to help you have a baby? When you meet your doctor, as I told you, there is going to be an elaborate chat wherein your doctor will be collecting your information and your history. Following that, you will be examined, and we will be ordering few basic workup tests. The women will be asked to undergo scans and few basic blood tests which will involve a hormonal profile, and the male partner will be advised to have a semen analysis. After looking at these reports, after looking at your scan and the blood test and the husband's semen analysis, we will be able to frame a treatment plan for you. The commonly used treatments are: 1 is standard intercourse, 2 is intrauterine insemination, and 3 is IVF. So we shall briefly look at each one of this. What do I mean when I say timed intercourse? So basically, we want to time the intercourse in and around the ovulation time. So in order to do this, we need to know whether you are ovulating or not. And to know whether you are ovulating or not, we need to look at the scans and the blood test. So if you are ovulating, your doctor will be specifying the time period during which you can have your natural intercourse. So you can try this for the prescribed number of months, and if it is not working for you, then you will be guided as to what is the next step. The other way of doing it, if you are anovulatory, that is, if you are a woman who do not ovulate, that is, release the egg spontaneously, your doctor will be advising what is called as an ovulation induction. So in ovulation induction, We will be giving you oral tablets in the beginning, in the first half of the cycle. Approximately from day 2 to day 5, you will be prescribed tablets which you take orally. These tablets will help you to grow good eggs. And your doctor will be doing scans to see if the quality of the egg and the size of the egg is good. And once the follicle or the egg, once the follicle reaches a particular size, the doctor will be prescribing you a trigger injection which will help you release this egg. So from the time of the trigger injection, you are expected to ovulate anytime between 24 to 36 hours, and you will be asked to have intercourse around this period. So this is regarding timed intercourse, which is a natural method of conceiving wherein we just time the intercourse so that we can aim at the ovulation time precisely. The next method which I mentioned to you is IUI, Intra-Uterine Insemination. This is definitely not test tube baby. The minute I mention the term IUI in the OP, many times I hear from patients, doctor, we do not want to go for artificial method. We do not want to have a test tube baby that soon. So let us not have IUI. So please have a clear understanding. IUI is nothing artificial. All that we do in IUI is we collect the semen sample from the husband. It is cleaned, processed, and we make a concentrated solution of the same semen, which will be having only the active, motile, healthy sperms in it. The dead sperms, the inactive ones, will be removed during this cleaning process. So this concentrated solution of the semen will be injected into the uterus. In a natural intercourse, the semen gets deposited in the vagina. The same semen is cleaned and deposited in the uterus in an IUI. That is all it is. So please do not panic on hearing the word IUI. It is a very, very simple procedure. It is a very, very cost-effective procedure, and it has helped thousands and millions of couples have a baby. It is very similar to the natural process. We are just bypassing one single step by doing an IUI. So please do not hesitate when your doctor prescribes you to have an IUI. The third and final thing that I would want to discuss to you is regarding the IVF, in vitro fertilization. In vitro fertilization is a process which is completely done in the lab using the ovary, the eggs from the ovary and the sperms collected from the husband. So once the eggs are grown, it is retrieved from the women, and the sperms are retrieved from the semen of the husband. So the best of the eggs are selected, the best of the sperms are selected, and the selected sperm is injected into the egg. This process is called as intracytoplasmic sperm injection, and this is the commonest and the most effective method of IVF which is followed worldwide at present. So it offers very good results. This is a very effective method of treatment which is available today. So we can definitely make use of all the treatment options available. So just make sure that you understand all these processes clearly. Any queries you have, please feel free to ask me. I shall definitely respond as much as possible. You can write to me directly, you can mail me, or you can WhatsApp in the number mentioned below. Thank you.